and the heart rhythm, palpitation,
and blood pressure.
And blood pressure.
They change.
So there are very
screen, dramatically change if you're in the screened area. And when you come out, your blood pressure rises, blood sugar level rises, and your heartbeat increases.
From that at the moment, is that right?
No, we do not.
I'm an agony.
I'm not diabetic. No, I
No,
don't.
but I mean the heart rate going up.
Oh, yes, that does. Yeah, the heart rate goes up. Yeah.
And you must be like that all day then, as you walk around.
I'm like
Not
that.
all of us. No.
Varying degrees.
Yes, that's the last question. If you like, someone did ask the question: Is sensitivity a personal thing? It is. Each people reacts in different ways.
So this conductivity test will identify people who have this condition and to the extent to which it's having.
Sorry, I don't really know. It was only just that they said they'd try that on me that day. They didn't say whether it was or not. But the one thing was, they were reading 1.60, well, saying they said that was normal, and I was reading 0.92. Now, whether it was relevant, I don't know, but that's what they said to me. He said there's an awful difference. He says all the signal that's going into you, he says, is staying inside you. You're not releasing it. That's how they explained it to me.
Okay, I'm trying to move it on because there are people in the gallery waiting to come in and make a presentation as well. To say a word of thanks to you all for coming in. Obviously the committee had tremendous interest in this issue and we're going to go through the recommendations and indeed possibly inviting Comreg as well. So clearly we'll inform you of what happens from that meeting as well, and thank you for your presentations.
Give a copy of my report to the members.
Yeah. And we're going to suspend for 15 minutes to allow people to get a break and to set up for the next session.
Chairman, thank the committee and thank the secretary for having us. Thank you.
Okay. So I want to welcome first of all Mr. Colin McGorman of 1 and 4, and we're going to talk about the Ferns report, and I'd also like to welcome also Deirdre Fitzpatrick, Advocacy Coordinator, Teresa Gaynor, the Clinical Director, and Bernadette Morris, the PA Director. Before I ask you to commence the presentation, I have to draw your attention to the fact that members of the committee have absolute privilege, but the same privilege does not apply to witnesses appearing before the committee. Members are reminded also of the long-standing parliamentary practice to the effect that members should not comment on, criticise or make charges against a person outside of the House by name or by way of making him or her identifiable. So I'll invite Mr. O'Gorman now to begin the presentation.
Good morning, Mr. Chairman. First of all, I'd like to thank you and the committee for this opportunity to come before you to perhaps air some issues that arise out of the publication of the Ferns report. It's always been our view that the report is such a substantive piece of work that it really needs proper consideration of a committee such as the Joint Committee on Health and Children to really look at the issues that arise out of it in terms of child protection. What we're eager to do today is to try and move the discussion around Ferns on to look specifically at current child protection practice and legislation and